Creating from the Heart, the Artistry of Living. I'm here with Nurse Practitioner Tracy Novak, one of my favorite people in the world. So, Tracy, what is it that a nurse practitioner does?
Well, we take care of patients.
I know, because you take care of me.
So basically, my role in the community is to help people achieve the best health that they can. And coming from a nurse background of approximately 16 years bedside, mostly critical care, I decided that I wanted to help people before they would need that and hopefully prevent them from needing that.
Well, you do a great job.
I try my best, for sure. Yes,
You do
yes.
fabulous. Did you think you'd be doing this when you were a kid?
No. So, I mean, you have those kind of aspirations. I mean, of course, I wanted to be a truck driver like my father when I was young. And then I decided that I wanted to be, after a lot of soul searching, I was going to be a psychologist. So I went to Purdue, and when I got there, I decided I want to do that. So then I was pre-pharm. I thought maybe I would be a pharmacist because I liked the sciences. And then I was falling asleep in the classes where they talked about what you did, and I said, this isn't a good idea.
That's because you didn't knit in class like I did. Yes.
So I decided that I wanted to be a dietitian. So I wanted to help people, particularly that struggled with weight and obesity. And I ran into a roadblock, organic chemistry.
Whoops. That'd be a roadblock for me too.
Yes. So I took the class twice, and then I was in school, and it was my 5th year, and I just wanted to graduate.
Yeah.
So I graduated with a degree in health promotion, which was kind of promoting health. So it was all along the lines of that,
right,
going into everything. And I was a waitress. That's what I did.
Okay.
So then my friend, who was a nurse, who never wanted to be a nurse, she was actually wanted to be a teacher, but because her husband was in the military, she had to do nursing. She would call me all the time and ask me questions about patients. And because I had this kind of background, I was like, you know what, maybe I should go to nursing school.
The bell went off.
Yes. So I took a year off, and I went to nursing school, did an accelerated program, and 18 months later, I became a nurse, associate degree nurse. I worked for 2 years at Franciscan Health in Michigan City, and then I became a travel nurse.
Meaning a contract nurse.
Yes, so I traveled across the United States. I've worked in 26 different facilities and probably 13 states I think I was licensed in. I did everything from heart and lung transplant, kidney, liver transplant. I did trauma.
All the stuff you were trying to prevent from happening.
Well, that became later, right? And then I had thought about going back to school because the travel jobs weren't what they were. And my husband was kind of not wanting to travel anymore. And so I was in Peoria, Illinois, because he wanted to be closer to the Midwest because of his job, because he traveled. And I went out to take my dog for a walk, and 2 large dogs lunged at us, and I fell down an embankment, and I broke my arm. And I will tell you that prior to that, I'd wanted to stop, and I had applied at St. Joe Hospital in Mishawaka to be a open heart recovery nurse because I wanted to learn more. I had gotten stagnant in my learning, and I didn't like that. And so I never necessarily thought I would ever not be a nurse, but I wanted to do more. And so I had applied, and I didn't hear anything. So when I broke my arm, I had made the decision that this was the sign.
Good girl.
That I needed to stop traveling, right?
Yeah.
So
and maybe a few other things.
Right, yeah. So I actually told my husband. I called my recruiter at the time, and I said, hey, I broke my arm. She's like, you're kidding me. And I was like, no. And you can't stay on as a contract person with a broken arm. So interesting enough, I had done a 6-month stint at Mayo Clinic out in Phoenix, Arizona. And they said they would take me back with a broken arm. And
what?
So I had to make the decision about whether or not I wanted to go back to Arizona to travel, or I really wanted to stay put and go back to school. So because I didn't hear anything from the hospital, I called them and I said, all right, so I applied, I didn't hear anything, like, we called you. And I'm like, well, I don't know who you called, but it wasn't me. So my interview with them was with a broken arm, and I got hired with a broken arm to be an open heart recovery nurse. I stopped traveling, And I went back and got my bachelor's degree, went straight into my master's. And
this is all in Arizona?
No, this was all in Indiana.
Indiana.
I declined the Mayo job.
Got it.
And then started working at St. Joe Hospital in Mishawaka doing open heart recovery. And so I worked there for 5 years while I was going to school. I worked full-time up until I started clinicals, and then I went to part-time, and then I went to PRN. And so I finished school, and I had trained in Michigan City with Jessica Bronner, another amazing nurse practitioner, and I didn't know where I was going to work. And I thought to myself that I was always going to stay with St. Joe because you get vested into these things, right? So I went and I interviewed at this hospital in Plymouth with a group of doctors and nurse practitioners. This is my first interview. Actually, maybe my second interview, but the first one was in Culver. I didn't want to drive that far. So the second interview, and I was very excited about it. It seemed very learning oriented, et cetera. And I was like, this is it. I'm going to, do a great job. Well, they told me that the doctor that worked there, basically didn't review a lot of the results or something, and they would just forward it all to the nurse practitioner to do. And I was like, okay. And so during the interview with the actual physician, I said, I hear you don't like to read your colonoscopy reports. Big mistake. Needless to say, I didn't get hired. They gave me something that I didn't have any pediatric experience, which I don't, and I didn't really want to do pediatrics, but I was willing to learn, right? And so I was kind of heartbroken. And so the doctor I worked with, Dr. LeMay, said that I should be hired within Franciscan. And so Dr. Matuk, who also worked in that office, said, I think Dr. Patel is hiring a nurse practitioner. So I called him, and he said, come in for an interview. I went in for an interview. I met with him and Dr. Nduku, and they said they would hire me. So then I met with Franciscan, and Dr. Patel would hire me, pay me nurse practitioner wage while I trained under him. So I'd already passed my boards and did all those things, and Franciscan said until I was credentialed, they couldn't hire me. So I was without work, and I'm like, well, I quit my job at the hospital in St. Joe, because I didn't want to do that stress anymore. I mean, the stress of working in that environment, and the surgeons we had at the time were not very nice people, but they did pull me in and they offered me a job, and I declined it. And so I started working with Dr. Patel, and Francis even called me and asked me if I would take on a retention bonus and kind of thing, but it was less money to work with Dr. Patel, but the passion that he had in his role and his kindness is just drove me to work with him, because I didn't always work with kind doctors. And so he was very patient with me, and I trained under him, and I think that provided a role model. And so after about a year, I started training nurse practitioners. And so even within Franciscan, they talk about how we should do more like Dr. Patel did prior to joining Franciscan, because we were originally private practice. And then unfortunately, when Dr. Nduku passed away, then it was hard for him to manage. And so we signed on with Franciscan, and haven't looked back. It's 2016 is when I started as nurse practitioner in October with Dr. Patel. And I wouldn't have had it any other way. Everything fell into place the way it should, even if it was me saying, I hear you don't like to read your own colonoscopies,
Have you ever told Dr. Patel that story?
I don't know if I did. I don't know. But I did tell him, and he doesn't remember that. I call it my first 2 years of nursing, when I was a baby nurse. I had this patient who I worked on the telemetry floor, is what they called it at the time. And she had knee surgery, and she went into atrial fibrillation. So she came to our floor. Well, the first day I had her, she was doing great. I mean, she was just really excelling at it. And the next day I came in to take care of her again. And I said, gosh, I'm like, you don't look good. She's like, I don't know, something's wrong. And, when you looked at her, at everything in the picture of it all, her labs and everything did look good. But she's like, it's like I hurt everywhere. And I can remember calling the doctor on call, or the doctor who was covering was Dr. Patel. And I told him, I was like, I don't know what's wrong, but something's not right. And I don't know how it all came to be that it ended up being diagnosed this way, but she ended up having necrotizing pancreatitis, and she was flown out that night to a bigger care center because of how serious it was.
Right.
And so that was kind of my big like, oh my gosh, like I didn't know what was wrong.
I can trust myself.
Yes. And then Dr. Patel listened to me,
Yes.
So he doesn't remember that, but I certainly do, because it impacted me as a nurse and my knowledge base. So,
and at what kind of doctor you wanted to work with.
Right. Yes, exactly, for sure. Yeah.
That is an amazing story. And here you are.
And here I am, yes. And I wouldn't have it any other way. When I found nursing, after searching for so long, I finally found what my father always told me to look for, which is do something you love and you will never work a day in your life. And so that was it. It was a home for me.
Yeah.
And now it still is.
I can tell. And I personally can't wait when I have an appointment with my medical person.
Well, it's all about that listening skill, Yeah.
And it's all about being heard.
Yes.
Oh, yes.
Yes,
that.
And that is the model that Dr. Patel works with, and so it's easy for me to work under that environment. So, yeah.
That's great.
Yeah.
So here you are in Michigan City.
Here I am in Michigan City, yeah.
So grateful. Do you have any advice that you would give someone who is, at the end of high school trying to decide what to do with their life, somebody who's lost their job?
So I think that it's never too late to change your path. And so, I did it myself several times to get to where I was. And when I went to nursing school as a bachelor's degree person, I was probably one of the older people there. I was also the most annoying, if you ask my classmates, because I always asked questions.
There's nothing like being older and A, asking questions, and B, having the wisdom to cut through the stuff and see what's really going on.
And you know what? And as the program progressed, they realized that actually, hey, she's not exactly asking bad questions, and it formed a kinship. But I think that if you want to help people, and you have a desire that you care, because no one should be a nurse or in the medical profession any more than being in a teacher profession if they don't have a passion for this, because it's not always going to be fun. It's not always going to be enjoyable. But the nice thing about nursing is there's not just one path. Yeah. There's all these specialties. So you just have to want to care about people. And if you do that, then you can find your way within the whole nursing program. And I found lots of my nurse practitioner students now went to very different backgrounds. But it all was based on that desire to care for people.
Key.
Yes.
You
don't have that. You can't teach that.
No.
You cannot teach someone to listen and relate to people. And I've seen that with some of my students, that you have these people who instantly can connect with anyone. And you know that they're going to excel at it. And then you have people who more are clinical without being so engaging. So they may find a different role in nursing. Not that they won't be good at what they do, but maybe it's just not what I'm doing.
That's right. And it's good to have it all.
Yes, exactly. Yes.
That's great. Well, Tracy Novak, if somebody wants to find you, how would they do that?
As far as to...
Just curious. Or come to you as a patient, maybe? I don't know.
So because of Dr. Patel's and I's practice, we don't take new patients.
Okay.
And because I have to have some amount of privacy.
Yes.
Because otherwise people will reach out to you in ways that they shouldn't. Then, maybe someone on here will have a family member that sees me, because if your family sees me, then I will take you on as a new patient. But currently, right now, we're not taking new patients. But a nurse practitioner in my office who I also trained and she's amazing.
That's great.
Yeah.
And what's her name?
Casey Bowski.
Okay.
Yeah.
So there you have it. What a delightful conversation with Tracy Novak. See you next time.